And now to what the Health and Human Services Secretary is describing as a game changer for millions of Americans struggling with obesity. The Biden administration is proposing allowing Medicare and Medicaid to cover popular weight loss medications like Ozempic and Wegovy. Till now, Medicare and Medicaid have only provided coverage for those drugs when they're used to treat conditions like diabetes. Finalizing the proposal will, however, be up to the incoming Trump administration. With us now, NBC News medical contributor, Dr. Natalie Azar. Doctor, it's great seeing you always. Who would benefit the most from this move?
So I think, Jose, a good starting point is to understand what the drugs are currently approved for. They are approved for individuals with type 2 diabetes. They are approved to treat obesity. They're also approved to treat people who are overweight and have one risk factor for heart disease. And they're approved for people who have existing heart disease who are overweight or obese to prevent a second event. Currently, commercial insurances do cover the medications, not obviously in all cases, for all of those indications. But as you pointed out, until now and currently, Medicare and Medicaid are not covering these medications for weight loss only. What the experts are saying is that if this changes, this would now expand coverage to a little over 7 million people, including people, as we are talking about, who currently have Medicare or Medicaid.
And so, doctor, how safe are these drugs? One reads all kinds of stories.
The overall safety of them is excellent. There are obviously reports of some more serious side effects that can occur. One of the main mechanisms of action of the way the medicines work is by making people feel full more quickly, and that's something called delayed gastric emptying. And in individuals who are already have risks, let's say, for something called gastroparesis, that can result in a life-threatening bowel obstruction. The issue, Jose, is that we don't have safety data going out beyond 5-10 years. These medicines, this class of medicine has been used to treat type 2 diabetes and now overweight and obesity for a decent period of time. But any potential long-term side effects, 10 years, 15 years down the line, we just don't have that data yet, Jose.
Do you think that this could convince or help convince maybe private insurance companies to cover these drugs as well?
I think so. Last week we actually reported on a report that indicated that about a little over half of Americans actually fall into those categories that I mentioned at the beginning of the segment, for which the medication is approved. And right now, insurance companies, they have the ability to deny or ask that a patient try and fail other conventional or other medications before they will approve it. But I think all of this research and understanding how the epidemic, unfortunately, of obesity has increased dramatically over the last number of decades will move the needle on coverage. And I think it's just important too, Jose, to say that we can do two things at once. We can, foster the approval of these medications for people who need it, at the same time looking very closely and trying to understand why we are in the situation we are in with so many individuals falling into those at-risk categories and doing something about that as well.